Hello, Dr. Jenkins here. We are here today in the lab to go over the skeleton. This is a much better lab in person, so if you have the opportunity ever to have the bones in your hand, I encourage you to do so. There are some moments where we can't do that, so I'm hoping that this video will help you with the bones, okay? We're going to do one video with the axial skeleton, and then we'll do another video with the appendicular skeleton. You will see in your lab objective sheet, or whatever I give you, you're going to have a list. And it is separated by axial. It's hard to do this, it's like a mirror. You'll see them separated by axial skeleton, and then you'll see a second set of bones called the appendicular, okay? What's the difference? Well, I have my trusty friend here. The axial skeleton represents the skull, rib cage, and vertebral column. That's it. Axial, center. Skull, rib cage, vertebral column. The appendicular are the appendages, arms, and the legs, okay? I'm going to break the skeleton. So the appendicular, think of the appendages, arms and legs, axial skeleton, skull, rib cage, vertebral column. One point that a lot of people miss would be concerning the shoulder girdle and the pelvic girdle. Technically, the scapula and the clavicle are part of the appendicular skeleton. The pelvis is also part of the appendicular, okay? All right, let's start with the axial. That's what this first video is going to be about. And if you look at your sheet here, we're going to start with the cranial bones over here. And you'll see that they're listed, but then beside it, there's another list. So for example, for the temporal bone, you need to know not only the temporal bone, but also these structures on the temporal bone. For the parietal bone, there's nothing beside it. So all you need to know is the parietal bone. However, for the temporal bone, you need to know the temporal bone and these specific structures on it. Anything that you see that has a little asterisk or star, that means that you can feel it. So what is that one? That is the mastoid process. That is the bump right behind your ear. Oftentimes, if you can feel it, sometimes it just helps you to remember it. That's not going to be on any practical or test, but it's only there as a way because it may help you remember. Okay, let's take a look at what we have here, and please work with me. So we have the skull put together, or the fancy word for that is articulated. So you're going to want to look at the skull put together, but we also have a fancy box here of the skeleton disarticulated, which is to say the skull bones taken apart. You are not going to need to know all of the bones taken apart, and I'm going to tell you what you need to know, so stay with me. Let's first look at the skeleton put together. We have this skull that is all one color, and then we also have what I like to call the multicultural skull, where each bone is a different color. This is a good study tool, but don't think I'm going to be giving you this on your practical. Too easy. I would recommend you first look at the parts of the skull. Frontal is up front, parietal are two bones up top, temporal are on the side, and then occipital is in the back. Okay, so you'll start there. This one is nice and colored. Frontal, parietal, temporals by the temple, and occipitals in the back. Same bones here, and they're separated by these sutures or immovable joints. Frontal, parietal, temporal, and occipital. You will be asked to know those sutures. So you'll see 4 prominent sutures. Now, guess what? For this lab, the skeletal, you do not, for me, you do not need to know the fontanelles for lab or the sinuses for lab. So you can cross off the fontanelles and sinuses. That should make you happy. But I would like you to know the sutures. Okay, those are just the immovable joints that connect them. The coronal suture is this one up front that separates the frontal from the parietal. The sagittal suture is what separates the two parietal bones. Should make sense though, because the sagittal plane is what divides our body into right and left halves. See how it all comes together? So the sagittal suture indeed separates our skull into right and left halves on the parietal bones. The back one is the lambdoidal suture, separates the parietal from the occipital. And on the side is the squamous, or sometimes you'll see it called squamosal. Either way, squamous or squamosal is on the side. That's how I remember it, S for side. It separates the temporal from the parietal. Now, once you've learned the major bones, you're going to go take it a step further and identify some of the specific parts of the bone, the bumps, the holes, the prominences, because these are really important. You probably don't want to hear me say this now because you're like, why do I have to memorize all these parts? But it is those bumps, holes that serve really important purposes. A lot of times a bump or a projection is used as a muscle attachment site. Much stronger to have a muscle attached to an irregular bump than a smooth surface. All of these holes have a purpose. This is the foramen magnum. It's the hole the spinal cord goes through. That's kind of important. So there's a reason why we're asking you to learn all these. All right, the frontal bone is up front. The orbit is just the opening where the eye is. The parietal bones, just know they're up top. The temporal bone. You're going to want to look at the temporal bone on the skull put together, but you're also going to want to look at the temporal bone taken apart. And you can see that it's the temporal bone because it has this nice sharp projection, which is, make sure I get the right side here. No, this side. Which is the same thing as this, right? So, on the temporal bone, I already mentioned the mastoid process, that is the bump behind the ear. The mastoid process is big and irregular. Okay? We also have something called the styloid process, sharp and pointy. The way that I remember that is I think about stiletto heels or stylish stiletto, and it's really sharp and pointy. If you can find any way to remember it, even if it sounds stupid, if it helps you remember it, go for it. Mastoid process, styloid process. Then we have the zygomatic process. This is your cheekbone. Zygomatic. So you think about cheekbone, zygomatic process. And then we have the external acoustic meatus. Meatus is a narrow opening. This is our ear hole. Boop. I need to show you my ear hole. External auditory or acoustic meatus. Ear hole, my friends. Ear hole. Okay? Good. Let's go to the next bone. The occipital bone is on the back. You're going to want to look at the the skull put together. And you're also going to want to look at it apart. The big giveaway for it apart is that we have the big foramen magnum. So occipital bone, that big opening, foramen magnum. Foramen means hole. Magnum means big. So it's a big hole. And that's where the spinal cord goes through. We have the occipital condyles. Where my two fingers are rounded bumps. If you look at them this way, they are convex. They're bubbly, they come out. These occipital condyles is what rests the skull on the first vertebrae. Anytime we see a condyle, it's going to mean a rounded edge. And it's a rounded edge where two bones come together. So these are the occipital condyles, number 19, I think, right there. But they're rounded, and that's what the skull rests on, the first vertebrae. Last thing we have is the external occipital protuberance. There's a bump in the back of the head. You can feel it on yourself. If you follow the back of the occipital bone, there's a point where it all of a sudden goes in. And right at that junction, there's a bump, external occipital protuberance. Some people call it the bump of knowledge. Either way. Now, there's two bones inside that you need to know, the sphenoid and the ethmoid. If we look at our multicultural skull, the sphenoid is the red. I'm going to ask you questions on the sphenoid in the bone taken out. Okay, because it's just too hard to see in there. But I want to make a point that this butterfly-shaped bone, the sphenoid, sits right in the center of the skull, red. Red. But you should look at its parts, taken apart like this. Looks like a butterfly, so you need to know what's the sphenoid. And then there's a list of structures you need to know on the sphenoid. We see the sella turcica. Now, the way that this bone is oriented is it's almost like the butterfly wings are where they would be if it was a real butterfly flying around. So the wings are up top, and then this part is on the bottom. Well, on top, there's this little depression. My finger is in it. The little depression called the sella turcica. So if you put it and look at the top, there's a little depression. See, it goes deep in there, and that depression is called the sella turcica. This is a really important depression because you know what sits in there? The pituitary gland. Ooh, it's getting hot. I'm getting so excited about bones, I get hot and bothered. It's true. So the sella turcica is this top depression, and that's what houses the pituitary gland. Then we have greater wings. They are the big butterfly wings. And then we have smaller wings. Yeah, these smaller ones on top are called the lesser wings. The big guys are called the greater wings. Lastly, we have the optic foramen. No, I'm going to get a pen to point to. I think it'll be easier. Or a pencil. Foramen means hole or opening. So the optic foramen are the holes in the lesser wing. There's other holes. The only one I'm asking you to know would be the holes in the lesser wing. This is where the optic nerve goes through. They almost look like the eyes of the butterfly. So if I look at it this way or this way, they are the eyes of the butterfly, optic foramen. Another bone on the inside of the skull that I'd like you to know is something called the ethmoid. To me, it looks like a big walnut. Okay? On our multicultural skull, it is colored like a mustard yellow. So if you look in here, it's right behind the nose. So this is a bone that sits oriented right behind the nose. It's that mustard yellow color right there. But I'm going to ask you questions on it individually. So the proper orientation of the ethmoid is that this little projection faces up or superior, almost like a little boat. This little projection faces up, okay? That projection, by the way, is called the crista galli. It's a really important projection because that's where the dura mater, or the covering of the brain, attaches. So you'll need to know overall, this bone is called the ethmoid bone. Its orientation is right behind the nose, and it is situated such that this projection is facing up. And the name of that projection is called the crista galli. Other things you need to know, the flat surface behind that projection, this is a flat surface. The flat surface behind that projection is called the cribriform plate. How I remember that is that it's flat like a dinner plate. Cribriform plate. Then, on the underside, we have what are known as the nasal conchae. The nasal conchae are folds in the bone. So if we look at this, situated just like this is the top because the projection is there. If we look at the bottom, you see all these folds. And what that does is it increases surface area. This is right behind our nose. So as we're breathing in all these folds are cilia, that help to filter our incoming air. And the fact that we have folds means we have more surface area, so we can fit more cilia to do more filtering. Now, I'm going to be honest with you. I'd be the same way if we were in lecture or in lab right now. To me, these nasal conchae look like the external female genitalia. I'm just going to say it's true. Now, hopefully, if you get this question on the bone practical, you're going to remember external genitalia, female. It's folds, right? Now, what's going to differentiate the superior nasal conchae from the middle nasal conchae? The superior nasal conchae are on the outside. They are indeed more superior, but I think it might be easier to point it out that they're more on the outside, superior nasal conchae, and then the middle nasal conchae are in the middle. Okay, superior nasal conchae outside, middle nasal conchae on the inside. Good. Next, you're going to see some of the facial bones. Some of these we can look at on the skull. The mandible is the jaw, but we're not going to say jaw, we're going to say mandible. On that mandible, you're responsible for a couple parts. The body is what we think of as this part of the mandible, body. We have a ramus, and that's this part up here. So the body is here, and then the ramus is between my fingers. Body, ramus, this part, ramus. And then up top, we have a rounded edge called a condyle. Remember, a condyle is a rounded edge. This is the mandibular condyle. This is what's going to fit into the temporal bone to form your temporal mandibular joint. Condyle. Body, ramus, condyle. The maxilla is the bone above your lip. It's purple here, maxilla. We have the, zygomatic bone is this yellowish bone. Now, the zygomatic bone connects with the zygomatic process of the temporal bone. And together it forms your cheek. But it's both the zygomatic process of the temporal bone, shown here in brown, and then an individual zygomatic bone. We have the nasal bone, top of the nose. We know the bottom of the nose is cartilage, but the top part here is actual bone, nasal bone. The lacrimal bone is orange. Get a little closer. The lacrimal bone is orange. That's where your tear ducts are. Lacrimal bone, tear ducts. If we flip this upside down, we have if I can get this, I'm having a hard time. Yeah, the red bone here is the palatine bone, the roof of your mouth. You can feel it with your tongue. Palatine, roof of your mouth. It connects with the maxilla, but this part here is the palatine bone. What else am I missing? The vomer. If you look into the nose, get a little closer. Oh, it's like Halloween. Oh. There's an orange bone that separates the two halves of your nasal septum. It's orange. It almost looks like a little Dorito, but you could probably simplify it by just knowing that the vomer is the little bone that separates your nose into two nasal septums. Vomer separates the nose. Lastly, we have the inferior nasal conchae. We already know that the ethmoid bone contains the superior nasal conchae and the middle nasal conchae. Just so happens that there's also an inferior nasal conchae, and if I can get into the nose, let's see, this way, right. It looks like in here. There we go. So it's not the vomer that separates the two parts of your nasal septum, but there's a little bone on the inside. It's like yellowish color. Inferior nasal conchae. Now, remember, you're going to want to study on the actual skull. You're going to want to study on the skull eventually that is not multicolored. You can use this as a study tool, but, oh, there we go. You can use this as a study tool, but for the practical, you're going to want to use this one. In terms of the separate bones, which ones do you need to look at? Let's make a list. Sphenoid, butterfly-shaped bone, look at it individually, sphenoid. Ethmoid, big walnut, look at the ethmoid individually. Be able to look at the mandible individually. Occipital bone. Frontal bone has the orbit, frontal, and temporal. That's it. All the other small facial bones, I wouldn't ask you individually, because let me show you what they look like. The small individual bones just look like little pebbles. It would be ridiculous of me to ask you that. But so all the other facial bones, I would ask you on the skull. Okay. You're also going to want to know for the axial skeleton, the sternum, rib cage, and vertebrae. Let's move on to that. Let's start with the sternum. I'm just going to show you here on the skeleton. Come on this side, be better. All right. The sternum is our breastbone. We know that. And it has several parts, okay? So you'll see that on your list. Let me just make sure I'm giving you the right ones. On the sternum, we have the top little piece. This is called the manubrium. Then we have the body, and then we have the xiphoid process. Okay, so the whole bone is the sternum. This top part is called the manubrium, body, and xiphoid process. This is why it's important to do your CPR compressions up top here. If you go too low, you can break the xiphoid process, and that could easily puncture a lung. And that would be bad. Last thing here is the sternal angle. And that's up top, the fact that there's a little depression. Sternal angle. So instead of it being just flat across, it comes down a little bit. Sternal angle. The ribs themselves. Make sure you know we have 12 pairs of ribs. Let me grab one individually. If you wanted to, you could look at a bone individually. So if you see this, you're going to know it's a rib. I would not individually ask you, is this a true, false, or floating rib? That would be mean. Be able to look at this bone and say it's a rib. But then, collectively, we have 7 pair that are considered true. Okay? 1, 2, 3, 4, 5, 6, 7. The first 7 pair are considered to be true ribs because their cartilage connects directly to the sternum. This is cartilage. We know we need our rib cage to expand and recoil a bit, so we know there's cartilage. What makes the first 7 pair true is that their cartilage goes directly to the sternum. The next 3 pair are considered to be false ribs. 1, 2, 3. The next 3 pair are considered to be false ribs because their cartilage comes together and joins before it goes to the sternum. So the bottom 3 are considered to be false ribs because their cartilage doesn't go directly to the sternum. Instead, for the false ribs, their cartilages all come together and then it collectively goes up to attach to the sternum. The last 2 pair are considered to be floating, and they're floating because they don't go all the way around. Here's one right there. Then we got a tiny one right here. There it is. Boop. These are considered to be floating ribs because they do not go all the way around. This rib ends right here. This rib ends right here. Floating. 7 pairs of true, 3 pairs of false, 2 pairs of floating. Last but not least, my friends, would be the vertebral column. Don't be scared. If you take time, you're going to be able to get it. Let's break it down. We're going to start with the 3 regions. So if we look at the vertebral column, the first 7 vertebrae are cervical, the next 12 are thoracic, and the bottom 5 are lumbar. cervical, thoracic, lumbar. You need to know that. You also need to know how many are in each segment. There are 7 cervical vertebrae, 12 thoracic, and 5 lumbar. Most textbooks these days give you a pretty easy way to remember that. Think about 7, 12, 5, and what time during the day you might have breakfast, lunch, and dinner. You're more likely to have breakfast around 7 a.m., 7 cervical, lunch around 12, 12 thoracic, and dinner around 5, 5 lumbar. Going towards the bottom, we have the sacrum and the coccyx. So the sacrum is this bone right here. Make sure you review the sacrum on the skeleton like this, but I could also just have it. No other bone looks like that, sacrum. And then the coccyx is a little tailbone. You do not need to know how many vertebrae fuse together to make each, the sacrum and coccyx. Just know that sacrum, coccyx. Now, that's a good start, but we want you to be prepared for your next level of education. So we're going to ask you to know what the vertebrae look like individually, just by region. So let's go through the 3 differences in our cervical, thoracic, and lumbar vertebrae. Let me line them up here for you. There we go. So if we just look at this, okay, we can see the biggest one is the lumbar. Why is it the biggest? Because it has to bear and support the most weight. So the biggest is the lumbar. The medium-sized one is the thoracic. And the smallest is the cervical. We're going to go over some other differences, but if we just lay them out, you can see the difference, okay? What are some other differences? Well, the cervical is the smallest. Put it against my black shirt. Something that is unique about the cervical vertebrae, in addition to being the smallest, it has these holes on the side. All right, they're called transverse foramen. No other vertebrae have holes in the side. They all have a hole in the middle, of course, for the spinal cord, but only the cervical has these holes in the side. What is unique about thoracic? Well, as we can see, there's no holes in the side. It is medium size. Something that I really look at for the thoracic is its spinous process is really angled. Almost looks like an elephant trunk. No other type of, if you look at the thoracic, its spinous process is just kind of straight out. But look at how pointy the spinous process is in the thoracic. And the lumbar is just the biggest, so you should be able to see lumbar and know what it is. Now, I would never ask you, is this an L1, L2, L3, L4, or L5? You would just need to be able to say, oh, that's lumbar. Oh, that is thoracic. And the smallest is the cervical. Now, of course, we're not done yet. Because, just to be fancy, the first cervical and the second cervical vertebra have their own name. So C1 looks unique, and C1 is called the atlas. Now, the atlas, C1, does have holes in the side, so we know it's a cervical, but its opening is more oval, and it has these condyles, these depressions right here. So C1 is called the atlas. It looks different than a regular cervical vertebra. A regular cervical vertebra has a smaller opening. Look at the atlas, big opening. All right? On your sheet, you're going to see atlas and axis, so you would need to be able to identify C1 is also known as the atlas, bigger opening. It does have the transverse foramen, but so do most of the cervical vertebrae, holes in the side. The axis is C2. Okay, the axis is C2. It does have holes in the side, but what is unique about the axis is it has this vertical projection called the dens or odontoid process. Almost looks like a mini penis, just saying. So it's unique. C2 is the axis, and it has this vertical projection. Because what happens is the atlas fits on top of the axis. And that special arrangement, because the dens sticks up into the atlas, that special arrangement allows for more motion. This is what allows us to move our head, yes motion and no motion. Atlas, big wide opening. Atlas has the vertical projection called the dens. And the remaining cervical look like this. Almost done, my friends. Now we're going to be asking you to know the typical parts of a vertebrae. So no matter, vertebra I should say, no matter if it is a cervical, thoracic, or lumbar, they all share some common parts. We're excluding the atlas and the axis. But every other cervical, every thoracic, and every lumbar has some specific parts. Before I do that, I forgot to mention one thing. One thing that I use to remember atlas versus axis, the atlas comes alphabetically before axis. So that's how I remember atlas is on top. Atlas, axis. Some remember the atlas because of Greek mythology, that Atlas carried the weight of the world. Because indeed, as I mentioned before, it is the occipital condyles that rest on the vertebral column, but now we know which vertebrae they rest on, the atlas. All right, last thing. Let's talk about the parts of a typical vertebra. Okay? The body is this part right here, body. The vertebral arch is composed of everything else. So if we were to break each vertebra into two main parts, there would be the body and then the vertebral arch. Now, that vertebral arch is made up of some other things, or has some other things coming off of it. One of them is the spinous process. That's what comes off the back. That's what I was saying in the thoracic vertebra. Looks like an elephant trunk. Spinous process. This is what you can feel in the back of someone's vertebrae. You can actually feel the spinous processes. Then we have processes on the side called the transverse processes. So the process coming off the back, and it's just one, is the spinous process. But the parts coming off the sides are called the transverse processes. We have a couple holes to talk about. The vertebral foramen is the hole in the middle, and that's what the spinal cord goes through. Vertebral foramen. If we were to put some vertebrae together, so if we pull up the skeleton here, if we were to look at them together, we will see that there are intervertebral foramen. There are spaces in between the vertebra. And you can only see these when the vertebral column is put together. Intervertebral, between the vertebrae. And what's coming out of these intervertebral foramen are the spinal nerves. Okay? Intervertebral foramen. Now, the last structures to look at on an individual vertebra would be the articular processes. Okay? Here's a lumbar vertebra. This is the top and the bottom. Okay, here's the spinous process, body. We can see on the back there are these two flat surfaces. These are called the superior articular processes. Right here. They're like little concave surfaces. This is called the superior articular process. You might see it called the superior facet, but we're going to use superior articular process. And then, of course, on the bottom, there's also some concave surfaces right there. So sometimes you can just use process of elimination. I mean, everyone knows body, and then the spinous process is the one back projection. If I'm asking you anything else on the back, and they're paired, and they're concave surfaces, they have to be articular processes. Then you just have to figure out, am I asking you the superior articular processes, or am I asking you the inferior articular processes? And why these are important is because this is how the vertebrae attach to each other. Let me grab another thoracic so you can see it better. Hold that thought. Hold that thought, my friend. Oh, we got some lumbar. I found some lumbar ones. So the articular processes are, let's see if this is going to match here. These are all from different sets, so sometimes it's hard to find ones that match well. The articular processes are how the vertebrae stack together, because it is the superior articular processes of one vertebra that attach to the inferior articular processes of the other. Okay, and you can see that connection right here. It is the superior articular processes of one vertebra that connect to the inferior articular processes of another. All right, folks, you can do this. Don't wait till the last minute. If we have 90 total structures to know, and you've got a week or 2 weeks to do it, break it down. What's 90 structures divided by 2 weeks? I don't know, 8 or 9 structures a day. You can do it. I'm here to answer questions if you have them. Good luck.